Hello, I'm Justin Chan.
I'm Toby Lee. We are PhD candidates from the PolyU Department of Biomedical Engineering and co-founders of Claire. Claire provides a streamlined AI-powered prediction and education tool for musculoskeletal diseases, enabling personalized treatment and point-of-care in this aging society. We aim to optimize disease management and promote healthy aging. Knee osteoarthritis affects over 10% of local elderly and causes debilitating knee pain. The multifactorial nature of knee osteoarthritis makes it challenging for doctors to accurately forecast the progression, often resulting in delayed diagnosis and irreversible damage.
And that's where Claire comes in. Leveraging the power of artificial intelligence, we have developed a groundbreaking solution that not only predicts the functional capability of the user, but also calculates the risk of knee osteoarthritis progression. This innovative approach enables healthcare providers to identify knee osteoarthritis early, without the need of costly X-rays and MRIs. It enhances the disease prevention and reduces unnecessary hospital visits, ultimately improving the patient outcomes.
We have also launched a self-management mobile application, which is user-friendly and accessible, catering to the needs of both elderly and their caregivers. It aligns with the government's primary healthcare blueprint, promoting prevention-oriented health-seeking behaviors.
We recently acquired a $3 million INT fund for better living from the government. And this fund supports our large-scale implementation of the screening system with our partners in the community, and the development of a novel, personalized rehabilitation training system with augmented reality technology for the late-stage patients. We are Claire, Poly Ventures.